There are two issues, I think, when it comes to diversity in the neurological landscape. One is the issue of representation by race and ethnicity. The other, we've done a lot to improve things in terms of the representation of women, but we have a lot of room for improvement when it comes to representation of women at leadership levels. So those were the two areas I focused on essentially during the presentation. So I'll give you some examples. So if you look at the US general population, Blacks or African Americans are about 13%. But if you look at the population of neurologists in the US, Blacks are at 3%. So very well underrepresented. If you look at Hispanics or Latinos in the US population, they're 18%. If you look at them in the population of neurologists, they're 6%. And so a lot for us to do in terms of trying to improve those representative numbers amongst neurologists. And you might ask, well, how does neurology compare with other specialties in medicine? So if you look at physicians as a whole in the US, African Americans are about 6 to 7% of physicians in the US. So even within physicians, neurology has a lower representation of African Americans compared to the average in the US. When it comes to women and the indicator of women at the top of academic leadership is usually department chair. And so right now, as of February this year, we had 16% of the department chairs, the neurology department chairs in the US being women. This is much better than it was before, but there's obviously a lot of room for improvement when it comes to leadership by women in neurology. And so the talk emphasized those numbers, also spoke about the reason why diversity is important, and underscored the fact that, number one, there's lots of empiric evidence to show that diversity improves creativity, improves outcomes, even cost outcomes as well. Another reason to consider diversifying the neurological workforce is that we know that populations like Blacks or African Americans or Hispanics and Latinos disproportionately experience neurological diseases. And we expect with time, as the country becomes less non-Hispanic white, we're going to have more a higher proportion of minorities and probably a higher level of disparities between non-Hispanic whites and everybody else. So that's a reason for us to want to train and develop these underrepresented populations in terms of neurology, because they are much more likely to be very interested in serving those populations that are disproportionately affected by neurological disease. Another reason is that we know that people who are underrepresented are more likely to mentor other underrepresented people as well. So it's one thing to speak about the patients, it's another thing to speak about trying to invest in people who are much more likely to pay it forward. So that's another reason to want to do this as well. I went on in the talk to give some examples of successful programs that went from not having diversity to having very impressive diversity. I gave examples of cardiology program that went from having no underrepresented in medicine scholars in their cardiology fellowship program to having almost 30% of the program being underrepresented minority. And I discussed the different initiatives they took to get there. I also gave the example of the Association of Black Cardiologists, which created a scoring card for all cardiology fellowships in the country. And so it gives them a red light, a yellow light, and a green light in terms of how diverse the fellowships are. And that is also helping to prompt fellowships to at least do all they can to seek diverse candidates in their fellowship programs. When you tend to measure people, especially publicly, it often tends to motivate people to take a particular situation much more seriously.